Cloudy skies, low vitamin D, the nutrient Britons are lacking most. Vitamin D regulates calcium, supports bone health, immune function, and may prevent chronic diseases. In the UK, limited sunlight, poor diet, and lifestyles lead to deficiency, needing supplements. Vitamin D is essential for a range of biological functions, with its primary role being to regulate calcium and phosphorus levels in the body, which are critical for maintaining bone health. Adequate vitamin D supports the absorption of calcium in the intestines, helping to form and maintain strong bones. Without sufficient levels, bones can become thin, brittle, or misshapen, leading to conditions like osteoporosis in adults and rickets in children. Beyond bone health, vitamin D plays a significant role in immune function, helping the body defend against infections and illnesses. Recent research also suggests that vitamin D may influence mood regulation, cardiovascular health, and the prevention of chronic diseases such as type 2 diabetes. Causes of vitamin D deficiency in the UK. Geographical and climate factors. The UK's cloudy and overcast weather is a major factor in the high prevalence of vitamin D deficiency across the population. The primary source of vitamin D is sunlight, which triggers its production in the skin through exposure to ultraviolet B, UVB, rays. However, Britain's geographical location, north of the 50th latitude, means that during the winter months, the sun is too low in the sky to provide adequate UVB exposure. Even during the summer, frequent cloud cover reduces the amount of sunlight that reaches the skin. This makes it difficult for most Britons to naturally maintain sufficient vitamin D levels year-round. Dietary factors. While sunlight is the most efficient way for the body to produce vitamin D, certain foods can provide it as well. However, these foods, such as oily fish, e.g., salmon, mackerel, fortified cereals, eggs, and liver, are often not consumed in sufficient quantities to compensate for the lack of sun exposure in the UK. A traditional British diet is generally low in vitamin D-rich foods, and fortified foods are not widely embraced by the population. This dietary gap exacerbates the problem, leaving many people deficient, especially during winter. Indoor lifestyles. Modern indoor lifestyles further contribute to vitamin D deficiency in the UK. With people spending more time indoors due to work, leisure activities, and the prevalence of screen-based entertainment, opportunities for natural sunlight exposure are significantly reduced. Even in summer, many individuals avoid sun exposure due to concerns about skin damage and the use of sunscreen, which blocks UVB rays. This shift toward indoor living has a substantial impact on vitamin D levels, making it increasingly difficult for Britons to meet their needs naturally. Health consequences of low vitamin D. Bone health. Vitamin D is critical for calcium absorption, and a prolonged deficiency can lead to serious bone-related conditions. In adults, low levels of vitamin D can result in osteomalacia, a condition characterized by soft, weak bones, leading to pain and fractures. In children, insufficient vitamin D can cause rickets, a condition that leads to bone deformities and stunted growth. Immune system weakness. Vitamin D also plays an essential role in supporting the immune system. Low levels of vitamin D weaken immune function, making individuals more susceptible to infections, particularly respiratory illnesses like colds, flu, and even more severe infections. Some studies suggest that adequate vitamin D levels may help reduce the risk of contracting respiratory viruses, which is particularly relevant during the winter months. Chronic health risks. Long-term vitamin D deficiency is linked to a range of chronic health conditions. Low vitamin D levels are associated with an increased risk of cardiovascular disease, type 2 diabetes, and certain cancers. Moreover, chronic deficiency may lead to higher mortality rates due to its impact on both immune function and overall health. Rapid detection through blood tests. Identifying vitamin D deficiencies early is crucial for preventing the long-term health risks associated with prolonged deficiency. Blood tests provide a simple and effective way to detect low levels of vitamin D, allowing individuals to take corrective action before serious health issues arise. Early detection can prevent bone deterioration, enhance immune function, and lower the risk of chronic diseases. Blood test procedure. The standard blood test for vitamin D deficiency measures the level of 25-hydroxyvitamin D, the form of vitamin D that circulates in the blood. This test is highly reliable and provides a clear picture of an individual's vitamin D status. The procedure is straightforward. A healthcare provider takes a blood sample, and the results help determine whether supplementation or other interventions are necessary. Testing accessibility. In the UK, various healthcare providers and labs offer accessible vitamin D testing services. Companies like GetLabTest.com provide specialized test packages that include micronutrient assessments, such as vitamin D levels, allowing individuals to quickly and easily detect deficiencies. These tests help individuals adjust their supplementation based on precise results, ensuring optimal health outcomes. Treatment and supplementation. Supplementation guidelines. Health experts and the NHS recommend that everyone in the UK consider taking a vitamin D supplement, especially during the autumn and winter months when natural sunlight is insufficient for the body's vitamin D production. For most adults, the recommended daily dose is 10 micrograms, 400 IU, of vitamin D per day during these months. However, certain groups, such as older adults, pregnant women, and those with darker skin, may require higher doses or year-round supplementation. Individuals who spend little time outdoors or who wear clothing that covers most of their skin are also encouraged to take supplements to prevent deficiency. Tailored supplementation based on blood test results. Blood test results can help healthcare providers or individuals tailor vitamin D supplementation more precisely. For those with severe deficiencies, higher doses of vitamin D may be prescribed initially, followed by a maintenance dose once normal levels are reached. Tailored supplementation ensures that individuals receive the appropriate amount of vitamin D, avoiding the risk of both deficiency and excess, which can cause toxicity. Source: Diageo Limited. https://www.diageo.com. https://www.getlabtest.com. office@diageo.com. Disclaimer: this press release, and the information contained herein, is being provided by Diageo Limited. It is intended solely for informational purposes and should not be relied upon for making investment or trading decisions. KISS PR, its employees, and its affiliates are not medical advisors. Readers are strongly advised to perform their own due diligence and consult with their professional financial, legal and medical advisors before making any decisions. For media inquiries or further information, please contact the source Diageo Limited at office@diageo.com.